Okay. Histology of the musculoskeletal system. We deal with histology of the muscle, bone, and cartilage. Okay. So we're going to see the explanation of the microscopic structure of the skeletal muscle, then about the various bone cells and their function, and also explanation related to the types of bone and the types of cartilage. Okay. So I hope it will be a good refreshment for all of you. So functions of the muscle, uh, the word muscle. Okay, it comes from musculus. Musculus means like mouse. Okay, so that's how the word muscle is derived. What are the functions? You know that it is related to body movement. It maintains the posture. It produces heat. Okay. It helps to propel substances throughout the body. Okay, what do you mean by propel substances? Means like for example, let's say, how does the venous drainage from the lower limb, how does it come towards the inferior vena cava, how does it come up? Because of the muscle contraction. Okay, because of the muscle contraction. Like I can just tell you about this muscle over here because it may be interesting now. So as you know that the veins in the lower limb, they are against gravity. They have to flow against the gravity, right? Okay, so let me draw something for you. So for example, if this is the leg. Okay. Okay. Right. Now at the posterior aspect of the leg. Okay, posteriorly. Okay, so these muscles, this group of muscles, they are called as calf muscles. Okay, these muscles are called as calf muscles. Okay, I had to draw my vein anyway. um, Let me change the colors. Right, so this is the muscle here, right? Okay, and now you have the veins here. Okay, so suppose the vein is running here. So you have actually two types of veins over here. It's called as superficial vein, and you have the deep veins. Okay, superficial vein and the deep veins. Now these muscles have to contract. Okay, they have to contract, and that's how it allows the deep veins to flow against gravity. It goes upwards. Okay, so these muscles have to contract, understand? So yeah, usually the superficial veins will drain into the deep vein. Superficial vein will drain into the deep veins. Okay, and these muscles have to contract. Now what happens in a case of a person who's lying down on the bed for a long time, that is after a long surgery or something? So obviously if he's not moving, the muscles are not going to contract, and this can cause DVT. Okay, so you have studied this also in POD. This is called deep vein thrombosis. Deep vein thrombosis. Okay, and you know how they check for this problem? When they come for rounds, they have to actually squeeze the calf muscles, and they have to check whether there is any pain. Okay, if there is any pain in these calf muscles, so it may be an indication that yeah, pain or tenderness in the calf muscle. That means it's an indication for developing deep vein thrombosis. Okay, so the complication, as you know, it's pulmonary embolism. Okay, anyway, the point for you to remember here, or something new, this muscle, just one of the name of the muscle is called soleus muscle. Okay, soleus muscle over here. Okay, so it is called as the peripheral heart. Okay, peripheral heart. Okay, so we have like two hearts. So this one is it's called as the peripheral heart, just because it is allowing to empty the blood like this. Okay, against gravity. Okay. Okay, now let's move on. So also it helps in heartbeat. That's your cardiac muscle, and also it helps in breathing. Okay. Okay. Thank you, Tayyib. Okay. Next, we move on. So the general features, it's mesodermal in origin. Okay, by now I hope you know that what is ectoderm, what is endoderm, and what is mesoderm, right? So ectodermal origin, structures are the skin, the new ectoderm, the brain, everything comes from ectoderm. The endoderm is related to the inner lining. Okay, your gastrointestinal tract, respiratory tract, the inner lining is endoderm. Okay, in between, whatever you find in between, it is mesoderm. Okay, so I think most of the musculoskeletal will come under mesoderm. Okay, so the muscle, the bone, blood vessels, all of them are mesodermal in origin. Is it clear? Okay, in between, yani. Okay, so it's mesodermal in origin. Okay, next. Okay, the what is a muscle? A muscle is a collection of muscle fibers. It's supported by connective. Okay, so we can see here that this is an entire muscle over here. So we have a muscle fiber we are showing. Okay, and now let's see what is inside the muscle fiber. So each fiber, each muscle fiber is elongated cell with contractile proteins, and they are called as actin and myosin. Okay, so there are proteins inside and they are called as actin and myosin. You can see here in this diagram. So this is actin and this is myosin. So these are contractile. Contractile means they help in contraction. Okay, so it's something specific only for the muscle, right? Now, interaction of these proteins causes the contraction, which is a unique function for the muscle. Okay. So, again, related to actin myosin, I hope in physiology they will take more details, okay, about how the contraction occurs and all that. Okay. Next. Okay, so now some terminologies you can see related to the muscle. Everything is like, sarco, the word sarco we use. Okay, so if the plasma membrane is related, okay, or the cell membrane or the muscle fibers, we say sarcolemma, sarcolemma. Okay, then if it is the cytoplasm of the muscle fiber, we call it as the sarcoplasm. If it is the smooth endoplasmic reticulum, which stores large amount of calcium, we call it as sarcoplasmic reticulum. Okay, then the mitochondria is also called as sarcosomes. Okay, so let us see all these terminology here. So this is a mitochondria, which is the sarcosome over here, which you're seeing. Then the sarcoplasm, that is the cytoplasm of the muscle fiber. Then you have this one is the sarcoplasmic reticulum, which you're seeing. Okay, and sarcolemma, which is outside, that is the plasma membrane or the cell membrane. Okay, so all these terms are clear, I hope. Next. Okay, so now there are three types of muscle. As you know, this is skeletal, then cardiac, and smooth muscle, also called as visceral, right? What is the other name for skeletal? We also call it as striated muscle, right? Okay. So, what are the other contractile cells? You have heard about them before. Okay, there is myoepithelial cell, myoepithelial. Okay, so it is along with the epithelial, it will be present along with the epithelium. So, it's called myoepithelial cell and usually seen with secretory acini, ish meaning this is like let's say the glands. So the if you have the parotid gland or the submandibular gland or the sublingual gland. Okay, so these glands, they have acini, right? Acini, secretory acini. Either it is serous secretion or it is mucus secretion. Now there will be a cell, it's called myoepithelial cell, which will be present along with it, and it helps in contraction, it helps to bring out the secretion outside. Okay, another one is called myofibroblast. Okay, it is related to wound healing. Wound healing. Okay, so these are the other contractile cells. So their word myo is there. So it has the contractile function. Okay, it's along with the epithelium. It's called myoepithelial cell, and if it's along with related to wound healing, it's called myofibroblast. Okay, I hope all these terminologies are clear for all of you. I'm sure you've heard it. Okay. Next, we have further details. The muscle fiber is an elongated, cylindrical, multinucleated cell whose length varies from few millimeter to 35 centimeters. So that long it can go. Okay. So either it is few millimeter to 35 centimeter. Okay. Can you tell me which is the longest muscle in the body? Anybody? Mm,
The femur?
sorry.
Femur.
Femur is a bone. Yes, sartorius. Sartorius is correct. Okay. Yes. Okay, it's over the, it lies over the femur. Okay, so that way you can remember it. So that was sartorius. Fine. Next, moving on. So anyway, now you're going to see these muscles also and going to know all the names. Okay. Okay, and the width can be from 10 to 100 micrometer. Okay. Now coming to the connective tissue around it. Okay, we have three names. We have epimysium. So if it's just outside, it's called epimysium, covering the muscle fiber. Okay, then you have, this is perimysium. Okay, in the next slide actually the definitions are given. And if it's it's going to each fibril, it's called as endomysium. Okay, so you have epimysium outside, then you have a perimysium, this is perimysium, and then each one is called covered by endomysium. This terminology is similar to I think we had even for the heart. So we have epicardium, okay, pericardium and endocardium, right? Okay, so let's move on. Further we can see what is epimysium. Okay, epimysium is dense connective tissue which surrounds the entire muscle. Okay, so this is the epimysium which is outside, right? In the histological section, this is the epimysium. Okay, do you want me to mark it, or it's okay for all of you? Let me mark it. This will be the epimysium and outside. Fine. Next, coming to perimysium. Okay, so what is perimysium? So perimysium is around the muscle bundle. Okay, muscle bundle fiber or fascicle. Okay, so this is called as perimysium, this part, right? Perimysium. Another color I should use. Okay, okay, so that is your perimysium. Sorry, yeah, perimysium. Okay, so here again we have, this is the perimysium. Right, next we have endomysium. Okay, so endomysium will be around each muscle fiber. Okay, so epimysium is around the entire muscle, the perimysium is around muscle bundles. Okay, muscle bundle fiber. Endomysium is around the muscle fiber. Okay, so where is endomysium? If we see, mm, okay, so this will be the endomysium. Okay, so I think it's clear to all of you. Next, moving on. Right. Now coming to the structure of again the muscle with under light microscopy. Okay. So each muscle fiber is elongated. It is unbranched. There's no branching, and it is a cylindrical cell. Okay. It has many flat nuclei. It lies below the sarcolemma. Sarcolemma. Okay. Okay, now it shows cross striations with alternate dark A band, okay, and light I band. And I don't know if I gave you this kind of, if you feel confused about this, I said dark, the word dark, DAR. So the second letter is A, right? So it's dark A. Yeah. So it's dark A band, and light, you remember I, so it's light I band, okay? And there's a Z line with a Z line. Um, okay, intersecting band. So you have the dark A band over here, okay, and these are the light I bands, okay, and these, the intersecting line is called as Z line, okay, it's called as the Z line, okay. Again, I'm telling you, this will be taken more in detail with physiology, okay. Okay, already you finished in physiology today, or I don't know when? Okay, okay, fine. Now coming to structure of further. Each muscle is made up of compactly packed long cylindrical myofibrils in the sarcoplasm, and they are arranged parallel to the long axis. Okay, so each fiber, like they're in long axis, and you can see cross striations under the light microscope. Okay, it is due to the presence of cross striations in the myofibrils, that is dark, that is again I said dark A band and the light I band and the Z line. Okay, so you can see that here, okay, this is the dark A band, okay, and then you have the light I band, and in between, can you see these, this is called as a Z line. Okay, so now from one Z line to another Z line, Z or Z, whatever you want to call it, okay, Z line, it's called as sarcomere. Okay, so the distance between two Z lines is a contractile unit, and it's called as sarcomere. Okay, are you understanding what is sarcomere? It is from one Z line to another Z line. Okay, so what is the Z line? Z line is the intersection between the dark A and the light I. Okay, clear? I hope. Here you can also see that this is called as a neuromuscular junction. Neuromuscular junction. So you can see that this is the motor neuron axon, and how it is the axon terminal, how it is coming and coming towards the muscle fiber. Okay. Okay. Now moving on. Under the microscope, light microscope, we can only see this much. We can see the cross striations. Cross striations means these lines. Okay, I hope you know this. Can you see all these kind of zigzag lines? These are called cross striations. Okay, you want me to draw or no need? Let me. Okay, yeah, here na the lines. Okay, these are called cross striations. Okay, so we again have prominent dark A bands and light I bands. Okay, and there are many flat peripheral nuclei. So these nuclei, these are peripheral nuclei, not in the center. So these are there are many of them, and the arrangement, they are long, parallel, cylindrical fibers and without branching. Okay, so can you tell me which one has branching? Which of them have branching out of the three types of muscle? Yes, in the heart. Okay, yeah, the cardiac muscle had branching. Okay, whereas skeletal muscle does not have any branching. Okay, okay, fine. And do you remember the nucleus in the cardiac muscle? It was more central. Okay, it is central, not peripheral. And what is the specialty about cardiac muscle? Anybody? What is the other specialty? One more specialty. Uninucleated. Okay. Intercalated disc. Yes, very good, very good. Okay, fine. Let's move on. This table also, I think you're aware of. Okay, so quickly you can hadikul like revisions. You started in basic human anatomy with this, then through all the modules you have finished. Like you finished smooth muscle, you finished cardiac muscle. Now the last you're doing, the skeletal muscle, and again like a revision to all. Okay, so the location, the limbs, body wall, tongue, the pharynx, and the beginning of esophagus. Okay, all this is skeletal. And here these are all the esophagus, then stomach, small intestine, large intestine, urinary bladder, blood vessels. All this will be smooth muscle, and the heart is having only cardiac muscle. Okay, shape here long and cylindrical. Here it's spindle shape. Here is again short and cylindrical. Here it's unbranched fibers. Here also unbranched, and here it is branching of fibers. About the nucleus, only this one is multinucleated, whereas these two are unnucleated or uninucleated. Sorry. Intercalated disc is absent in skeletal and smooth, and it is present in cardiac. Okay, moving on. Okay, the nerve supply. Coming to the nerve supply, here it is supplied by cranial nervous system, the skeletal, whereas the smooth and the cardiac is supplied by autonomic nervous system. So when we say this, along with this, we also say that the cranial nervous system, that means it will be voluntary. It is under our control. So it is function will be voluntary. Okay, whereas these if it's under the autonomic nervous system, it is not under our control, so it's involuntary. It's involuntary. Yes. Okay, good. And what about the blood supply? Here it is abundant. Okay, abundant means it's rich. Because for the reason, like, think when you have to run, you need a lot of blood supply so that there's a lot of ATP there, and then it has to burn, and so that's why it's abundant. Okay, whereas in smooth muscle, it is scanty. Okay, and cardiac muscle, yes, it's abundant because it's constantly it has to uh, what do you call that, beat. Okay, contract. Okay, and then here contraction, here that it is rapid contraction. Like you can imagine, again, when you finish running, you feel you can run fast. Okay, so that's your contraction, it's rapid. But there's fatigue after that, you feel tired, and that's fatigue. What about in the small intestine, large intestine? It is slow. The contraction is very slow. Okay. Yeah, you can think about how the digestion occurs very slowly, but there is no fatigue. Okay, so it does it constantly, but it's slow. Okay, here it is rapid contraction, but never fatigue, never fatigue. Okay, the fatigue is only at death. Okay, next, coming to khalas function, we finish. So kulu okay for everybody? Good. Kulu revisions, huh? Okay. What about the girls now? Nobody's answering anything. Girls mojud or mo mojud? Hmm. Okay, good. Okay, fine. Next, functions of the bone. It is a storehouse of calcium. The bone marrow present in the bones. Also, you have manufacturing of RBCs. Then there is granular WBCs and platelets. Okay. Also, it gives attachment to the muscles, acts as a lever for the movement. Okay. And it forms cavities which encloses and protects various viscera. So, what do you mean by that? Like, for example, you have the thorax, and the lung and the heart is inside. Okay, so it forms cavity. The same way, the skull. Okay, it is a cavity, the bone, and you have the brain being protected inside. Okay, and it also gives a supporting framework for the whole body and transmits the body weight. Okay, so it gives a framework for attachment of muscles and everything, and also it transmits the body weight. Okay, hadikulu just like a review or revision, nothing new for all of you. Okay. Okay. um Now coming to the surface of the or the properties, we see the external surface is covered by periosteum and the internal surface is covered by endosteum. Okay, so we can see here this hadi barra outside. Mm, Here, this is the bone, right? This is the periosteum here. Okay, also we can see here this is the periosteum, and the inner lining inside, okay, that is the endosteum. That is the endosteum. Inner lining is called as the endosteum. Okay, so the periosteum, it covers the external surface of the bone, and it does not cover the articular surface. Okay, I think this point always you have a confusion. Okay, related to the joint, I will show you what does it mean. Okay. mm, okay, or we can say this surface, you see, this is the articular surface. Articular surface means it's going to form a joint. Like, this is what, for example, this is the femur. The head of the femur will articulate with the acetabulum. Okay, so you have this acetabulum, that is a part of the hip bone. So this surface is called as articular surface, is called as the articular surface. Not this part is not going to articulate, only this part, right? The head of the femur. Now this articular surface will not be covered with periosteum, will not be covered with periosteum. That's it. Okay, the other areas will be covered with periosteum. So whenever it is going to form a joint, okay, the periosteum will not cover that area. Is it clear? I had many students asking me last time also, so I hope it's clear. Again, I will try to show in another diagram. Okay, now in the periosteum, there are two layers: outer vascular and inner cellular layer. Okay, outer vascular and inner cellular layer. So here we can see there are two layers. Huh? Here, two. One is outer. Okay, so we can call it as outer vascular. Okay, and inner cellular. Cellular means with lot of cells. Okay, now, there's lots of there's a lot of rich nerve supply over here. It is very, very sensitive, and it's involved in bone growth and repair. Okay, so this is the importance of this periosteum layer. So that's exactly the reason why it is not present on the articular surface. Okay, see, if it is present on the articular surface, what will happen? It is going to be constantly in friction with the other bone. Yes, it is coming in between the two, then it will cause a lot of pain because it is a very sensitive layer. Okay, so that's the reason why periosteum does not cover the articular surface. Okay, now I hope you will remember. Okay, uh, it's very important in bone growth and repair and healing, and it's very, very important that they preserve it during bone surgery. So masalan, somebody has done a surgery for the bone, fracture bone, whatever, and they should not strip the periosteal layer. Okay, the periosteum is very, very important because that's the one which is going to help in bone growth and repair. Okay, so they have to take care of this layer. Is it clear? Okay, next, moving on, we have the endosteum. Are you feeling bored, students? Because it's repeat, or it's okay and I just like a revision for everyone? Okay. Because obviously many terminology will come again with pathology, with other, departments, and it's better just to have a look into it. Yeah. Okay. Now, this is the endosteal layer. Juva. It's a thin membrane of vascular, loose connective tissue lining the medullary cavity. This is also called medulla. This medullary cavity, Juva. In the long bones and marrow spaces in the cancellous bones. Cancellous bone is also called as spongy bone. So we have like two types of bone, right? We have compact bone and we have cancellous bone. Okay, so it will line the medullary cavity of the long bones. Okay, so this is a compact bone they've shown, like this is a long bone, this is a compact bone. Okay, and wherever you see like this, it's like a spongy kind of an appearance. That's called as a cancellous bone. It's called as a cancellous bone. Okay, clear. And it extends as a the endosteum, it extends as a lining into the canal system of the compact bone. So from here you have these blood vessels, the endosteal lining. Okay, from here it will go through, uh, can you see these lines over here? So these are all the, the Walkman's canal, and through that it will pass, the nutrition will pass till it will be communicating between the outer layer and the endosteal layer. Okay, there will be communication between the two. Okay, right. And do you remember your Harvation system? These are the Harvation systems here. You can see the circles over here. Okay, fine. Now let's move on. Okay. If you have any doubt, you just write it down. Okay, cancellous is like cartilage. No, because cartilage has something totally different. Don't say that it is like cartilage. Cartilage is made up of chondrocytes. So we'll just say that it's spongy in shape, spongy. Okay, like easily it can break. Like this, you can remember. Okay, what about canal system, Sarah? Okay, let's move on and keep the questions to the end, please. Okay. Now, the bone composition. Okay, so we have the bone. If you talk about the what it's made out of, it's a specialized dense connective tissue. Specialized dense connective tissue. Okay, so it is having two types. It has organic components and it has inorganic salts. Okay, organic components and inorganic salts. Okay, so what does the organic components do? It gives, it has, the collagen, the fibers, and the ground substance. Collagen, fibers, and the ground substance. And it helps in giving elasticity and resilience to the bone. Okay, elasticity and resilience to the bone for remodeling. Okay, so if I say, you know that the bone is quite hard and you feel that the bone cannot, really change shape. But where do we see example for it? We see in orthodontic tooth movement. Okay, ish meaning the people who wear these braces, the people, the patients who have problem with the teeth alignment. Okay, so they put those braces, right, those on the teeth, right? And this is called orthodontic treatment. So when they apply those braces, there is remodeling, there is remodeling of the bone which is happening over here. Okay, so that's because there is elasticity and there is resilience to the bone, and it is because of the organic component we are able to achieve this. Is it clear? Okay, that's why we have the orthodontic tooth movement. Okay, now coming to inorganic salts. Inorganic salts, we have the calcium phosphate and the calcium carbonate. Now what does that do? That gives hardness and rigidity. So as you know that the bone is very hard, like any bone, you cannot just it's not malleable, you cannot just break it or you cannot move it around. Okay, it's quite hard. So the hardness and the rigidity, it comes from this inorganic salts. Okay, so it has both the components. Understood? Next, coming to cells. Okay, very 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 important. Okay, these cells are quite important. Let's see them. So again, we have four types of cells. Osteogenic. So genic means they are precursor. Okay, so they are the mother cells, no, the precursor of other types of cells. They are found in the inner layer of periosteum. So the location is inside the inner layer of periosteum. Okay, they are precursor of other type of cells, means they can change into another one. Osteogenic can go change into osteoblast, like this. Okay, so they are precursor of other type of cells. Okay, so like stem cells. Okay, next, osteoblast. Okay, so when the word blast is coming, that means they are young cells. Okay, so they are found where the active bone is formed, where where there's bone formation happening, they will be there. The osteoblast will be there. They're very young fellows, remember, like this. So they are large basophilic cells with rounded eccentric nuclei. Okay, so that is their description. They are basophilic with round eccentric nuclei. Osteoblast location is active bone. Active bone. Osteocyte. Okay, osteocyte is resting cells in the bony matrix. So the bony matrix will be there, and they will be these are the cells of the bone. Okay, they're called osteocytes. The cells of the bone are called mainly the osteocytes. If they're young cells, they are called osteoblast. Okay, and they lie in spaces which is also called as lacunae. They are also called as lacunae in the matrix. Okay, so their osteocytes are resting cells. Next, coming to osteoclast. Okay, osteoclast. So they are large giant cells, and they are present where bony resorption is required. Okay, the meaning of resorption means, like, when you want to eat up the bone. Okay, so that's where you have these osteoclast. Okay, and here the cytoplasm is eosinophilic, so it's pinkish, and you have 5 to 15 nuclei. Remember, it's like 5 to 15 nuclei, and it's big, large. That's why it's called giant cells. Okay, okay, so actually you will hear tumors also, like osteoclastoma, and there will be a lot of giant cells in that. Okay, so like that you can remember the names, which cell will improve, will increase, and all that you will learn. Okay, so Kalas, there are four types of cells: osteogenic and a precursor. Osteoblast, they are young cells, okay, where you have active bone formation. Osteocyte, they are the resting cells, and osteoclast are the giant cells with about 5 to 15 nuclei. Okay, let's see more details on them. So the first one, again, osteogenic cell, we can also call it as stem cells, osteogenic or stem cells. Okay, next is osteoblast, and they form the bony matrix. We said where you have active bone formation. So active bone formation, we have lots of osteoblast coming up. Osteocyte, yeah, these are resting cells. Khalas, they are, yeah, they have developed from this osteoblast, they convert into osteocyte. Okay, so they'll be the resting cells, they'll be the resting cells. Okay, and then you have osteoclast. We can see how many nuclei, 5 to 15 nuclei. They're also called as giant cells, like it, as if it's going to eat up. Okay, you can see all the teeth over here. So this is the it helps in resorption of the bone. Resorption of the bone, the word meaning of resorption means, see, this is a continuous process. Okay, there is new bone formation happening, and there is osteoclast. It helps in resorption, it will keep eating it up. Okay, and this is like a cycle, it keeps on happening. Okay, so either one of them, if there's going to increase or decrease, it's going to cause some pathology. Inshallah, you'll study that later, but this is a continuous process which is happening in our body. Okay, okay, now this table. Okay, so we have the first one is, we don't have the osteogenic cells mentioned here, right? Only the it starts from osteoblast. So again, it's a bone former. The function is bone former. And here it's the osteocyte is a bone maintainer. And it's like we said, the cells are going to sit, rest. Okay. Then we have the next one is a bone destroyer. Okay. Helping in resorption, helping in resorption. The shape here, it is young cells, cuboidal in shape. Here they are mature cells, oval in shape, with a lot of cytoplasmic processes. Ish meaning cytoplasmic process. You can see here. Can you see all these things, these extensions? So these are the cytoplasmic processes. Okay. Then here the giant cells, they are quite irregular giant cells. Okay, these are called irregular. Okay, because of lots of nuclei. Okay. Next, we already said that this is basophilic cytoplasm. Here also it is basophilic, but it's less basophilic, like less blue. Here it's acidophilic, okay, uh, or we said eosinophilic, right? Okay. Then the nucleus here was one nucleus. Here also it is single. Here it's many nuclei. Okay. Location. Okay, location. If you notice, it's on the surface of the bone. Okay, you can note this. You can write. Like, see. Let us see. So here it's on the surface of the bone. Here it is embedded in the bony matrix, and it's jua in the bony matrix. Okay, and here also it is on the surface of the bone. Okay. Okay, now coming to histochemical reaction. Here alkaline phosphatase positive. Here there's nothing in a special. Here it's acid phosphatase positive. Okay, so again, like I just told you, in some carcinoma, like it's called what, osteoclastoma. So I think the acid phosphatase level also will be increased. Okay, so like this you can correlate between the biochemistry and the cells and the pathology. Okay, now origin. So osteoblast is derived from osteoprogenitor, yani osteogenic cells. Understand? So like for example, here there is osteogenic cells. Okay, so osteogenic cell, we said that it is the precursor for everyone. So from osteogenic cells we get osteoblast. Okay, now from osteoblast, this osteoblast will develop into osteocyte. Will develop into osteocyte. Okay, and by the way, this osteoclast has total different derivation. Okay, it is from blood monocyte. It is from blood monocyte, and it shows phagocytic activity. Okay, so that's why it helps in resorption. So this is it's a phagocytic activity. It's totally different from the other type of cells. Okay, so anyway, you have learned other examples, right? Remember in the liver, what was the name of the phagocytic cell? What is the name of that? Anybody? Hmm. Kupfer cells. Yes, very good. Kupfer cells. Okay, right, fine. So now coming to osteogenic cells. So we said that it is a precursor for all the cell types. It's found in the inner layer of the periosteum. Okay. So okay, here I can just show you how. Mm, okay, here the osteogenic cells, like how it's on the surface. Osteoblast is also on the surface. Osteocyte is not shown clearly. Where is it? It is in the lacunae. Okay, so here, like it's in the bone here, it's in the in the bony matrix. Okay, so these two, if you see osteogenic and osteoblast, they are on the surface. You notice here they're on the surface. Okay, whereas osteoclast is going to the inner aspect, inner aspect of uh, the bone. Okay, okay, moving on. Yeah, here you can see. Right. Okay. These are osteoblast. These are osteoblast. Okay. This is called osteoid. Okay. Again, it's helping in the bone formation. Okay. Osteoid, it's one of the component helping in the bone formation. These are osteocytes. As you see, it's inside the bone. Okay. So this is the bony matrix. It's inside the bone. And where you see the white space, right, that's called as lacuna. That's called as the lacuna. Okay, and these are osteoclast. As you see, they have lots of nuclei in them, lots of nuclei. Okay, so these are osteoclast. Remember, giant cells. Okay, kabir, they are huge. Okay, so these are osteoclast. Okay, all of them are looking acidophilic for you. It's okay, it depends on the photo. Okay, but yeah, don't worry. Okay, just I'm not going to ask you these cells again. Okay, just for you to know the cells and the location. That's it. Okay, so you just know the variation and where they are located and the function. Like we said, osteoblasts, they are young cells. Okay, they are young cells or immature cells helping in active bone formation. Osteocyte, they are resting cells. They come inside the cell. So from the periphery, you can imagine as if they're coming, growing and coming inside. Okay, so that's the osteocyte over here. And osteoblast gets converted into osteocyte. Okay, yeah, okay. And then osteoclast, it is a totally different cell. It is derived from the blood monocyte, we said, and it helps in phagocytic activity. Okay, osteoid. Right now, just remember that it is involved in bone formation. That's enough for you now. Okay. Yes, I will tell you what is important from my side. Okay, now just now you'll listen to me. Then I will tell you in the end. Okay. Okay, now here you have fibers. You just have like 95% of fibers. Okay, and then and they're composed of collagen type 1. Do you remember the mnemonic or whatever you had studied with Dr. Subhan, right? So you had type 1, type 2, type 3, and type 4. Type 1, 1 for bone, right? So here you can see that the bone has type 1 type of collagen. Okay, type 2, do you remember what it was? Who wants to answer? 2 is in cartilage, right? 2 for cartilage, right? And collagen type 3, it's present in many places. Okay, type 3 is present in many places. And type 4, where is it? Type 4. Okay, another one. Yeah, skin. Yeah, maybe. Okay. Basement membrane. Basement. 4 is basement. Tahat. Okay. Right. Okay. Uh, I should have brought that slide also over here. Okay. Okay. Now let's go to inorganic comp. Okay, we finish this. Ground substance is 5%. It's chondroitin sulfate, dermatin sulfate, and the specific glycoprotein. The inorganic components, we said that they are the hydroxyapatite, okay, which is made up of calcium phosphate, 85%, calcium carbonate, 10%. These components are deposited on the collagen fibrils. They give hardness and rigidity to the bone. Okay, fine. Now moving on. Okay, so these are some procedures or terminologies. Decalcification. Okay, decalcification. This process of removal of the inorganic components. Okay, the inorganic components are removed and then the bone becomes soft and flexible. So these are called decalcification. Calcination, it is removal of organic components, then the bone becomes brittle and fragile. Okay, brittle and fragile. Okay, and ossification, it is the process of bone formation, okay, formed from a soft tissue model. It's either a condensed mesenchyme or a hyaline cartilage model. Okay, so there are two types of ossification. We say endo chondral ossification. Okay, that's from the cartilage model, or membranous ossification. Okay, it's from the mesenchyme. Are you understanding? There are two types of ossification. There are two types of bones, we said, right? One is the cartilage type, okay, hard one, yeah. And then you have the membranous ossification. Okay, yes, thank you, Safwan. Okay, now coming to the role of vitamins, okay, and related to the bone. Okay, so vitamin D. Okay, vitamin D, it is necessary for the absorption of calcium for the normal bone growth. Okay, not getting it. Okay, fine. Something happened to the screen, is it, students? You have subperiosteal bleeding, so you can see all these bleeding spots over here. So the patient will have bleeding from the gums. Okay, so this is called vitamin C deficiency, scurvy. Okay, no, deficient calcination means it is the calcination process is not perfect. What is calcination? Calcination is removal of organic components, and then usually the bone becomes brittle. Okay, so this is the normal process of calcination. Okay, okay. So if there is a defect in it, okay, the defect in calcination, so that causes uh, where was it? Yeah, that causes vitamin D. I mean, related to vitamin D deficiency. Okay. Yes. Okay. Now moving on, vitamin A. Okay, so it's necessary for ossification. So what is ossification? We just said it is bone bone growth, right? And we said there are two types of ossification: endochondral ossification related to the cartilage, and endo or membranous intramembranous ossification related to the membranous bone formation. Okay, so if that, now here we have two types of yeah, no, issues. One is related to deficiency, another one is related to excess. So if there's a deficiency in vitamin A, it causes delay of bone formation and growth. Yes, correct, Rinath. Okay, deficiency causes also delay in bone formation and growth. Okay, so because we said that there's a problem with ossification, the bone formation will be delayed. Okay, if there is excess of vitamin A, there is acceleration, an increase in the ossification. Ossification will happen very fast. So results in early fusion of the epiphysis and the diaphysis, and both are going to cause short stature for the individual. So the patient is going to be short in both the cases. If there is going to be delayed bone formation also, and that related to deficiency, he's going to be short. And if there's going to be early fusion of the epiphysis and diaphysis, then also he will be short. Okay, but obviously it will be associated with other symptoms, like she was just saying, deficiency of vitamin A is also causing night blindness. Okay, yes, fine, because here we are only dealing with the bone. Okay, I'm just telling you, this is only the bone, related to the bony symptoms. Okay, okay, you want a break, or khalas, we'll continue? I think it's very short, we can finish it off. Okay, I think I need to stop the recording, otherwise. Okay, one second.